Hi, everyone. Good evening. My name is Tracy Bisson. I am the founder of the New Hampshire Dog Walking Club and the owner of It Takes a Village Pet Care. I am here with Dr. Tasha Wilson of Acupetvet. How are you, Dr. Wilson?
I am doing well, thank you.
Thanks for joining us again tonight. I know we've got a very important topic tonight that we are going to discuss, geriatric care for dogs. And I'm hoping a lot of people will turn out for our live conversation tonight and let us know your questions. We're going to be getting into a little bit of a sensitive subject tonight too, as well, talking about when you have to make that important decision to let your pet go over the rainbow bridge, as they say. So we're going to touch upon that tonight. And I have a senior pet myself, so this is a very important conversation for me. It's my first, well, I have senior cats and a senior dog, so I'm really looking forward to your advice on geriatric care in general. But before we get started, I wanted to give everyone a little bit of a taste of what we're going to be talking about tonight before Dr. Wilson introduces herself. She's going to be discussing why you should monitor a dog's blood work, the importance of vaccinating older pets, food and supplements for senior dogs, and when it may be time to say goodbye, as well as a number of other things. And just to let everybody know, tonight we are actually broadcasting into 5 Facebook groups and pages. So I just want to say hello to the Dog Walking Club. I want to say hello to Mary's Dogs. Folks who, Mary's Dog is our charity of the month. We are creating awareness and raising funds for them. I also want to give a shout out to my group, My Pets Best Life, who are hopefully listening in with us as well. So thank you, everybody, for joining us tonight. So Dr. Wilson, why don't you tell us a little bit about what you do in your profession and at Acupetvet?
Sure. So I've been a veterinarian for about 15 years. And 4 years ago, I started a business called Acupetvet, which basically it's specifically for acupuncture and rehab therapy. I see a lot of geriatrics. I love working with senior dogs. They definitely are, they need different things. And we're going to be talking a little bit about that today.
Awesome. So I know you have a fantastic presentation like you normally do set up for us. Do you want to jump right into that?
Sure.
Okay. And if you have questions for us, please feel free to just chat them, and we will present them to Dr. Wilson throughout the presentation.
Great. Well, it's really good to be here. Thank you guys for joining us.
Dr. Wilson, you have to share your screen with me again.
Oh, okay.
It actually, yeah, for some reason it fell out of the stream.
Okay, we will fix that.
Perfect. There it is. I'm going to pop that in. All right. Excellent. We are ready to go.
All right. Great. Do you see that okay?
I do. Thanks.
You're welcome. So yes, it's really good to be here with you guys. As I said, I see a lot of geriatric pets. I love geriatrics. I think dogs in general take up such a special part of our heart. And when you have them for a longer time, or even sometimes when you just adopt a senior dog, it's just something really special about them. I do have little quotes in here that may make you teary-eyed like they did with me a little bit. So hopefully you'll enjoy them as much as I did, though. So this one here is, if you don't own a dog, at least one, there is not necessarily anything wrong with you, but there may be something wrong with your life. And I do think, isn't that beautiful? Yeah. I think, they take up a special part of your life, and they just bring something to your life. So I want to talk first about veterinary visits. I think it's really important for senior animals to see the vet regularly. Generally, veterinarians will recommend twice-a-year visits. And there is a reason for that. The older they are, the faster things can change within their body. And we like to just double check things, make sure things are going okay, so we can catch things early, sometimes for prevention and sometimes for treatment too. So generally, when I do an exam on a dog, like right now, like I said, I specifically do acupuncture and rehab. But when I was in private practice, I would do basically a regular exam on senior dogs twice a year. And I basically would check them over from ears, mouth, all the way down to tail. Abdominal palpation is really important. Listening to the heart and lungs are really important. So that's why your veterinarian recommend you coming because there are some things that we really just need to keep an eye on. And sometimes your dog won't show any changes. I think we talked about this last week where, a lot of animals, when they're not feeling good, they don't show you they're uncomfortable until they're really uncomfortable. So it's really important to get those twice a year exams done.
Well, and Dr. Wilson, at what age is a pet or a dog normally considered a senior pet?
Yeah, so usually I like to see them twice a year by 9 or 10 years old. Cats, if you have cats, you want to see them younger than that for twice a year. But for dogs, I would say that's about getting up to the senior year, especially at 10 years old. You definitely want to see them twice a year.
And that's regardless of the size of breed?
Yes.
Okay.
Yep. I would say that's a really good point, though, because larger animals tend, unfortunately, to not live as long. So definitely more probably around the 8 years old for the Great Danes and the larger dogs.
Yeah.
That's a great question, Tracy. So the other thing that we do is senior blood work. And generally that's recommended once a year. Sometimes if we do it and they're 10 or 11 years old and everything looks good and their exams are looking good, we might not repeat it. The main thing we're doing that is we want to check the health of the organs that might not be visible to us to see what type of function they're having. And as they get older, kidneys and liver can actually start changing, and we can see those changes in blood work. Red blood cell count is really important too. Unfortunately, if there is some signs of cancer internally that we cannot see, sometimes changes are seen there in the red blood cell count. A urinalysis is also something we recommend with the blood work. And again, that's to keep an eye on the kidneys because that actually gives us a good idea of what's going on in the kidneys. Of course, we also look for urinary tract infections. But generally speaking, when we're talking about senior blood work, we're really just looking for overall health of internal organs, and that's where the urinalysis comes in.
And Dr. Wilson, just to go back a second for something you said in the first slide in regards to 2 times a year visits. So my girl is 11 and the vet has not suggested 2 times a year for visits yet. So I'm wondering if they have one visit and everything shows clean, everything looks good, would you advise maybe that the second visit be with someone like yourself so that you could help address any pain or weakness or different things that you would notice? And I asked that specifically because I know I had a consult with you, and just the different exercises and tests that you did on my dog were very different, obviously, than were done at the traditional vet. So I wonder if there's some, what are the benefits there in talking to you as a holistic vet that could really benefit our senior pets?
I appreciate you bringing that up, Tracy. I don't think I would take place of the second year visit just because I don't do the diagnostics, and I'll do an exam, but depending on the animal's comfort level, especially first time meeting me, I want them to feel comfortable for a session. So sometimes I do not feel the abdominal palpation as much as I would on a regular primary practice. So I don't think I would take place, but I do look for things a little bit differently. And I definitely learned a lot of different techniques looking for evaluating pain in dogs than I did in veterinary school or throughout my private practice. And that's muscle palpation. That's feeling certain joints for discomfort. Different techniques to learn. Okay, is this leg putting as much weight on? Is he putting much weight on the left side versus the right side of the body? And that's something I assess during the consult. Sometimes I'll actually do measurements of the muscle mass, which we wouldn't do in private practice. So definitely, from that perspective, I can give a little extra information to you for your senior pet in regards to discomfort or pain.
Wonderful. Thank you.
Oh, you're welcome. And the exercises too, it's really great for animals to have certain exercises, even if overall their pain level is good, because I find it's a really good stimulation for them, not just physical, but mental stimulation too. Especially when they're older, they might not want to do as much. And if they have certain things they can do inside the house with you, it's great. I think it really just helps them decrease the chances of them, dementia, things like that, just kind of slowing down the process of aging.
Well, I think my favorite exercise that you showed me, and I've explained it to a few people since we met, was the balance ball.
Oh, yeah.
The front paws were up on the balance ball and you were coaxing her with a treat. And she seemed to really enjoy that. And, as I thought about the workout that she's getting on her core muscles and just strengthening overall, I thought, that's fantastic. And I think, you showed me things that I can do in my home with potentially things I already own and just enrich her through all these different exercises that you detailed for me.
Yeah, absolutely. And you mentioned the core strength and balance too, especially when they get older. Sometimes there might be something going on internally with them, or something just in general as they get older, where their balance isn't as good. And that exercise actually is a really good one for that. Yeah, I like that exercise. My dogs love it. They see the balance ball and they I know I'm gonna give them treats, so they get very excited. I got one that I swear is gonna walk up the wall, do anything I tell them to do just for treats. So when you show a balance ball, they get really excited. So here's another quote that I liked. The world would be a nicer place if everyone had the ability to love as unconditionally as a dog. How true is that, right?
Certainly is. Your kids don't rush to meet you at the doors like dogs do. Even if your dog's in pain, it may not be able to get up and greet you, but that tail will be wagging, just unconditional love. I love it.
Absolutely. So I wanted to talk a little bit about vaccines. So a lot of times we think as animals get older, they don't need as many vaccines. And I am one that I think it's important to look at the risk of a patient and a dog and find out what we may need to protect them, especially as they get older, because they still need that protection. Rabies is still very important when they're older. And thankfully, there are a lot of vaccines now, like rabies and distemper and parvo vaccine. That is a 3-year vaccine. So, if your animal's 10 years old, you get that vaccine, you won't need another one until they're 13. So I still recommend vaccines. I think it's so important to protect them against the things that we can protect them against. There's Lyme and leptospirosis vaccines too. Again, it depends on the risk, but Lyme disease is everywhere. And we do want our older animals to still get outside and do things. That's really important for them, as I mentioned, for mental stimulation, physical activity. Even a little bit, a 5-minute walk is huge for an older animal. And so they still have that exposure to Lyme disease. And Lyme disease can be fatal if it affects the kidneys. So that's something for you to know about and to really consider still vaccinating them with that when they get older. Leptospirosis is another vaccine that is still important. Leptospirosis is something that can be fatal, can affect the kidneys and liver and cause damage to the point, unfortunately, they get very, very sick. It is a disease that can potentially be passed to people too. So if a dog had it, it's in their urine. So if something happened and you somehow got your dog's urine on your hands and accidentally touched your face, there is a chance that you could get it. And it varies in sickness for people, but it's still something we have to be concerned about. So it is still a vaccination I would recommend. Of course, like I said, it's really important to look at each individual patient and definitely talk to your vet about what they think your risk is for your pet. But those vaccines are still important. There are some titers. I know a lot of people talk about titers for dogs and taking blood work and sending it out to see if they need vaccines. A rabies vaccine, highly recommend the vaccine still. There is a college, I believe, a university, it does do rabies titers, but we don't know the significance of that. So if it comes back positive, we don't know if that really will protect your dog. And given the fact that rabies is fatal and can be a concern for you as well as your pet, really highly recommend still doing the rabies vaccine. And then distemper and parvo, there is a titer for that. So if you really are concerned and you really want to do less vaccines, that would be the one I would recommend a titer for.
And for Dr. Wilson, for those people who might be new pet owners, can you just explain what titers are?
Oh, absolutely. So titers basically, what they are is help us decide if an animal is immune to a certain disease based on their antibodies in their bloodstream. So we as veterinarians would take a blood draw, we send it to a lab. It can be costly, a lot more costly than vaccinations, but it'll help you know if your dog is protected against those diseases. Usually we wouldn't consider that until, I would say, at least the second or third year of getting vaccinations and making sure that they actually have that coverage.
Well, there's actually a great video conversation that you and I did last year, as I recall, on core vaccines and kind of the vaccine debate, whether or not to vaccinate your pets based on the fact that some people are not vaccinating their children. So if that is something, if that's a rabbit hole you want to go down, then check out our videos in the Dog Walking Club library. There's some good stuff there.
Yeah, that was a great talk. We had a really good discussion about different vaccines. And if you have any questions in more detail too, don't hesitate to leave a comment even now, today, or later on. I'll be checking the thread too and keeping an eye on that to answer your questions.
Great, appreciate that.
So nutrition, I love nutrition. There's a lot of things we want to think about when animals are younger, but especially when they're older. There are many prescription diets out there that your veterinarian might recommend your pet be on, and that might have to do maybe with some heart issues that are starting to happen as they get older. Maybe there's some liver concerns or kidney concerns. So that's when the prescription diets come in. The other thing to think about is weight loss or weight gain. Now, some animals, when they're older, because they're not getting as much exercise, and unfortunately, I think our animals are more prone to becoming obese nowadays, we have an issue with a lot of weight. And a lot of the senior diets are actually higher in calories. So when you go and look for food over the counter, it's really important to keep an eye on the calories and talk to your veterinarian about it too, because a lot of senior diets, which is where you go because you want the best for your pet, and you think a senior diet would be the best, but if they're overweight, it might not be. The other thing to look for is the protein levels, because a lot of food right now is really promoting higher protein in diets, which isn't always good. And in fact, I think some of the protein levels in dog food is too high. So you want to make sure the amount of protein is more of a normal protein level. Higher protein can be harder for the kidneys to function. So the higher the protein levels can be harder in the kidneys, which if an animal has a predisposition to kidney issues, it could be problematic. And if your animal is losing weight, you'd want a food that's higher calories, potentially higher fat percentage. So you want to look for that too. So I think nutrition is so important for prevention as well as treatment. So it's really important to, when you see your veterinarian during these twice-a-year sessions, to talk to them about nutrition and find out what would be the best for them. And supplements. I'm going to talk to you about some supplements that you might not heard of before. There are a lot of supplements that I recommend for senior animals that you generally don't see at your veterinary clinic. Joint supplements, we had a great discussion last week about joint supplements. There are many out there for dogs, whether it's your younger dog or an older dog, but you want some reputable joint supplements that have studies that go along with it. You want to make sure the joint supplements have some credibility. There's a company that I really like called Nutramax. Again, I talked a little bit about their supplements last week. One of them is called Dasequin Advanced. I highly recommend that, especially for older animals, because a lot of times they're going to have arthritis. And if you already have arthritis, it's really important that you get on a good joint supplement. Treats that are out there. I know a lot of you go out and get treats. I see a lot of treats out there for my pets, and sometimes they have glucosamine in it. And there's nothing usually wrong with those treats, but it might not be enough glucosamine and chondroitin sulfate to help out for joints. And those treats will say good for joints, and they'll give you those ingredients. But you need something more than that, and you definitely need a more concentration, more milligrams than that's what you see in those treats. Omega-3 fatty acids, the same thing. You want to make sure you get a good brand. You want to make sure that it comes from sardines or anchovies for the source of the fatty acid. There are ones out there that talk about salmon. Sometimes they say farm-raised salmon. You don't want those. Again, Nutramax makes another good one called Well-Actin Advanced. I really like Well-Actin Advanced because they made it specifically based on joints and osteoarthritis in dogs. Their concentration is a lot higher, and they give you a dose specifically for that, where a lot of omega-3 fatty acids, the dose they give you is not good, high enough for joint issues. It's just good for skin and overall health. Now, these are the ones that a lot of people haven't heard of. Some of them are fairly new, even new to me. I went to a seminar, I think it was at the beginning of the year, and Imiquin is one of them. And then at the bottom there of the slide, you'll see Mysoquin. Those two supplements are are great for overall health for any animal, but I specifically like them for geriatrics because they help out with the immune system. So they're basically immune boosters. Mystoquin actually is a probiotic, so it helps out if you have a dog that might have an occasional digestive issue, maybe some loose stool periodically. Maybe you have a dog that does like mine does and want to find an access to the trash, and then you have unfortunately an accident later on. So it's always good to have a probiotic on hand, and honestly for older animals I think it's good to give regularly. So either Mystoquin or Immuquin is a good immune support for older dogs. And then there's a newer supplement called AccuGlow. And that one I actually learned about because of my own dog. My own dog is Jenkins, which I don't know if you guys been to my Facebook, you'll see pictures of him. He's all over. He's my favorite.
That's a boy.
He's a good boy, and he's had a lot of health issues, poor thing. He actually had a knee issue last year, had surgery, and then I think it was October of last year, he started bumping into things. And he's young. He's 6 now. And I went to go see the specialist to see if they could see something in his eyes that I couldn't. And lo and behold, they said he had a genetic condition that was going to make him blind within potentially 3 months to 3 years. And she told me about a supplement that, there's some research out there. A lot of supplements are not FDA approved for people, and they don't have claims on their labels because they have to be extra cautious about that. But she said, I've seen the research. I feel good about this. I think it's good to try. And I actually started my dog on it. And I will tell you, lo and behold, I had a recheck in February. She said his eyes look great. He hasn't bumped into anything. It's a mixture of different types of herbs. And a lot of the blend that they have is proprietary. So they won't tell you the secret ingredients. One of them is omega-3 fatty acids, though. And there are a couple other ingredients in there that's supposed to help overall health and eyes. So I say if you have an older dog that is starting to have some vision issues, it's good to start early. Just go ahead and get them on this as a preventative. There are some reviews out there. Some people swear by it that it helps stop the progression of potentially cataract formation. Again, it's kind of like one of those things where we have to try and see what happens because they don't have an actual claim on their bottle. But from what I have seen and heard from the eye specialist, and as well as what I've seen with Jenkins, I recommend it.
We do have a few questions here.
Sure.
Let's see. So Jody would like to know, are these supplements you have listed good for older cats as well?
That's great. It's a great question. The Geriatric Advanced, they do have one for cats. I think that it would be phenomenal for cats. Cats don't show you when they have arthritis, but 80% of them over 8 years old do. There actually was a study where they took x-rays and they found all this arthritis in these cats that weren't showing any signs. And the Well-Actin, I believe the Well-Actin Advanced is a newer formula. They do have a regular Well-Actin for cats. They don't have the advanced formula, but you can definitely touch base with me and I can help you out with the dose on that if you decide to do that. And then the immune system, the Immuquin, definitely has one for cats. There's a different probiotic that I would recommend for cats. They don't have a Mystoquin yet for cats, but Fortiflora or ProViable is there are a couple options for probiotics for cats. And the AccuGlow, that's a great question. I do not believe they have a cat formula yet for AccuGlow. I'd have to, I'll look into that and I'll let you guys know.
Okay, great. Yeah, thanks, Jody, for bringing up our feline friends. We don't want to forget about them as well.
No.
Now, a couple back questions. Clarence posted a question, and since there's a delay in the actual broadcast of the video, I believe he's referring to the foods that you mentioned. So he wanted to know what certain brands you like for senior pets.
Yeah, so it all depends on what might be going on with that pet. Like I mentioned before, I like Royal Canin a lot, and that's CANIN. And they have dog and cat food. They do a lot of research on their food, and they have a lot of different types. So it's hard to tell you specifically what type to get from the Royal Canin. I do nutrition consults, so you can definitely reach out to me, and I can kind of guide you accordingly too. But the Royal Canin's a good brand. Science Diet is also a good brand. They do a lot of research. I like to make sure they actually make their food in their own manufacturing plant too. A lot of types of food actually, like they'll write up a recipe and they'll send it somewhere else to actually make the food, and then they don't have control over actually the ingredients that go in it, and that's when you see a lot of recalls. So that's one thing I look for, and I also make sure they have a board certified veterinary nutritionist or an animal nutritionist on staff, because a lot of pet food companies do not have that. There's actually a huge list of questions that I usually reach out to different companies and ask. And what I'll do is I will actually put that link on this thread for you after the broadcast, so you can see that. But you go to wsava.org and you go to a Pet Owner's Toolkit for Nutrition. They'll actually tell you specifically what you should look for in pet food and what questions to ask the company. And I'll call them up or email them to find out, do you have a nutritionist? Do you make your own food? Do you check your ingredients periodically to make sure it still has good quality? How often do you check for salmonella? Royal Canin, they won't let bags of ingredients in their company until they check to make sure there's no contamination. And then Hills does the same thing. Science Diet. Purina One is also one that is has some good products. They have different qualities of their products. So some of them are more of a lower quality and some of them are higher. For dogs, they have Purina Pro Plan, Smart Blend. Those are higher quality for the dog food.
And so, Dr. Wilson, that was wsava.com, and go to Toolkit?
Yep, it is .org, O-R-G.
Okay. I'm just going to flash that up on the screen here.
It's funny. I was just thinking that. And and I can, it's a Toolkit. And you can, if you Google that, you'll come right up to the link.
Okay. Perfect. Great resource. All right. Let's see what other questions we have here. So let's see. Oh, I had a question here from Louise, but where did it go? It's like some of my questions. Oh, there it is. Here we go. I thought it had disappeared. So Louise asks, what are your thoughts on the canine influenza vaccine?
Oh, that's a great question. So the canine influenza vaccine is more for decreases the chance of the dog spreading, but not necessarily getting the disease. We don't see a lot of it around here, so I usually don't recommend it unless your vet thinks you're at higher risk, which would be ones that travel a lot, maybe go to dog shows, things like that. But even then, depending on where you're going, it might not be something that you need. It's not one of the what we call core vaccines, one of the vaccines that we generally vaccinate for them. And I will tell you, I still periodically will help out veterinaries and go to different veterinary clinics, and a lot of them don't even have the vaccine.
Great. Thanks for your question, Louise.
That's a great question.
A couple follow-up questions I have for you, Dr. Wilson, is when you're choosing a flea and tick remedy for an older pet, do you have any recommendations or suggestions on a certain type or brand that you prefer?
Yeah, so there are a lot of different things out there for animals, for flea and tick prevention. Being a veterinarian that likes to look at alternative therapies, I have looked at different types of like essential oils, herb mixtures, but there really isn't anything out there that's proven. I get really concerned about the chances of getting different tick diseases, and you can get different infections from fleas. So I still recommend the typical flea and tick preventions. There are ones that seem to work better in older animals. Seresto collar, I have always liked. Seresto collar is a flea and tick collar that you can leave on your pet for 8 months. There is potentially some concern that older animals might have multiple diseases. It may not work the best for them. They could have more side effects. I personally have not seen that, but it is some thought, and I think it's even now on their label. So when it comes to other flea and tick preventions, there are topical as well as oral. I think it really depends on what your comfort level is. Some people really don't like the topical flea and tick. Frontline Plus is a good topical. It doesn't get into the bloodstream, so if you're more conservative and really want to limit the exposure of different chemicals in your dog, that would be the one you can do. And then there are some ones that you can take by mouth. I would say if you have a pet that has always taken the topical one, I would stick with the topical. And if you have a pet that has had the oral one before and hasn't had any issues with it, then I would stay with that. The one thing about the oral one that always gets me a little bit concerned is, unlike topical, you can't wash it off. Like once you ingest it, it's in their system. So if there was an allergic reaction, what do you do? It's rare. In fact, I don't think you really have to worry too much about that. But I like to be cautious, and I like to, if you have an animal that is already using topical, things are going well, I wouldn't change it.
Okay, great. And I know, again, last year you and I had a great conversation about the different types of flea and tick remedies and what to look out for. So again, that is in the New Hampshire Dog Walking Club pet library. So I appreciate you touching on that. And then just one more question before we go into our last slide is, I've heard rumor that giving dogs fish oil tablets as well as turmeric is beneficial. Do you have any thoughts on that?
So fish oil is great. You get the omega-3s in there, and turmeric is good too. The thing is about turmeric is that turmeric is not the active ingredient that actually helps decrease the inflammation. Turmeric gets broken down into curcumin. The Days of Quinn Advanced that I recommended actually has curcumin in it. So when I look at supplements in general, I would say make it easy on yourself. Don't worry about mixing things together. Try to find a supplement that has the majority of the ingredients that you're looking for, and that's why I go with the Days of Quinn Advanced. It's a great question. I think turmeric, I think is helpful. It's just you got to make sure that you have the right brand. It gets easily absorbed. It gets broken down in the dog too, because you want to make sure it gets down and broken down into the curcumin. There is a website, and I got a blank here, that actually looks at different supplements for animals and pets, and they will rate it and tell you a little bit more about the ingredients. And I will have to get back to you on that website. I want to say it's Consumer Reports, but it's not Consumer Reports. But it's something similar. Okay. And it's a great resource for humans for supplements. And you go on there and you look. And there was, I actually looked up turmeric, and a lot of the supplements out there have a lot of extra ingredients in the turmeric supplements that are available for humans. So you want to make sure it's as pure as possible.
Okay. Excellent. Well, I know you have a very important topic on the next.
Yeah.
Are you prepared?
As best as I can be.
All right. Here we go.
Yeah. So, this saying, I will say, I've always liked Winnie the Pooh, but I didn't realize how much amazing sayings he has out there. And this one really caught my attention. How lucky I am to have something that makes saying goodbye so hard.
Yeah, Winnie the Pooh is wise.
Yes.
Wise.
And when it comes time to make that decision and put your animal to sleep, it's got to be the hardest decision. I've been through it myself several times, and it's absolutely heartbreaking when it's my own pet. And I feel for clients, because usually, even in private practice, I would have a relationship with these clients and with their dog, and you want to do what's best for them, and you want to make sure you're making the right decision. And so it's really hard when you're at a crossroad and you're trying to figure out, is this what I really should do? Is this really what's best for him? Am I thinking more of myself? Those are the questions that I've asked myself when it comes time, and I know clients do too. Because, and I'm sure I have some clients listening now, you guys have called and asked, and I think it's really important to ask those questions. So I'm going to talk to you a little bit about some of the things that people ask me, what I look for, and what I tell them to look for. But I think it's really important that if you do have questions, have that conversation with your vet, have that conversation with your family members, talk to them about things that you're seeing, and see what they see, because I think it's important to have a family conversation, and you all be in the right, you guys all talk about it, and you guys all decide together what the best decision is.
Well, I think especially too, if you have young children, it's such an important conversation to have, because it's probably the first death that they'll experience. So to make them a part of that conversation before they have to, see a parent or a grandparent pass, I think is valuable.
Yeah, yeah. I think the one thing to think about too, and as you're talking, I was thinking about this, that, when we make that decision and we decide it is time, it's really important and really, really important to know you're giving a blessing to your pet when you do make that decision. Because I know it's really hard, and I know and many times I hear owners say, "Oh, I'm so sorry, I'm doing this to you," and honestly, sometimes it is the best decision. So it's really important that you know that you're doing it because you love them, and it is peaceful. And I'll talk a little bit more about that too. Um, but when you think your animal is at that point, a couple of things to look for. You want to, of course, look for their quality of life. So how do you do that? Because that's really um, a very broad question to ask, and you have to really think about deeply to really decide. And what I ask is just look at what they usually do during the day. Do they greet you at the door? Does the tail wag? As we talked about when you come in. So maybe their hair is gone, so that they don't hear you when you come in. But does the tail wag? Do they get up to greet you? Um, do they still go outside to go to the bathroom? Are they having accidents in the house? A lot of dogs, you know, they get to the point, unfortunately, maybe where they're having accidents, and owners are concerned that maybe I'm making this decision because I don't want to clean up after them. Well, your dog might be at the point where he doesn't want to be doing that either. He doesn't want to be at that point where he's having accidents. Um, so it's really important to really try to feel from your dog's perspective too, and really think of what he used to love to do and if he's still able to do it. Now, sometimes when they get older, they don't play his ball as much, and that makes sense. But if you had the ball and you gave it to him, will he hold it in his mouth? Will he look excited to see the ball? Those type of things. So I usually say, think about 5 things that your dog loved to do. And if 3 of them they still love to do, then you probably get a little bit more time. But I think more than that, then you have to think about if it's time or not. And it varies. Tracy, you have older dogs. You said, have you ever put any animals to sleep before?
Just cats so far. My first dog is 11. I mean, when I was a child, obviously we had dogs that we had to make that decision, but I was never really a part of it. So this will be pretty raw for me when it's time to make that decision for her.
It's hard, and I think our dogs sometimes give us a little bit of mixed messages too sometimes, because some days they have really good days and some days they don't have such good days. So I always tell people, even if it's on your phone or a paper calendar, just put like maybe an X on the calendar for not so good day, or a smiley face or a thumbs up for a good day. So you can kind of look back at that and say, you know what, she's having a really good day today, but the past 3 weeks she hasn't. So when it comes time to make that decision, you can look back and really truly know that you're making the right decision. I think that is so important. Last thing, I would want you to do is make that decision and then ponder it afterwards and potentially regret it. It's really important that you feel good about your decision, as good as you can feel about it.
Well, and is there any pre-planning advice that you would give so that pet owners aren't trying to make decisions when the emotions are really raw?
Yeah, that's a great question. So I think what you can do is, if you know your animal's getting older, or especially if they got maybe diagnosed with disease that potentially is going to be what ends up making you make that decision and putting him to sleep or her to sleep, it's really good to reach out to your veterinarian, find out what they usually do for that. Some veterinary clinics do house calls, some don't. So it's important to know about that ahead of time. And if they don't do house calls and you want to do house calls, start making those contacts. I do some at-home euthanasias. Unfortunately, I don't do them right now because of COVID. But I've had people reach out to me when their animals are 8 and 10 and just say, hey, I want to have a relationship with you, because at some point I do want someone to come to my house, and I want them to know you, and I want you to feel comfortable with my dog, and I want my dog to feel comfortable with you. And I, as a pet owner, would want whoever comes to my house to do that, to feel comfortable with me too. so that way they had a relationship with me. And I saw them regularly for a while until that time came. Um, so that so that's something definitely to look into, especially before you get to the point where there's an emergency situation. Because unfortunately, last minute it's going to be really hard, especially if you want to do a house call to get someone to come in, and then it's really hard to make that call to the vet, to say, hey, I this is really bad. I need to rush in my dog right now. The one thing people always tell me, well, if I schedule it, what if he has a good day that day? A lot of veterinarians are completely understandable about that. And if you decide last minute to say, you know what, things are looking okay, I think they'd understand. That's something you can definitely talk to them about. But I have no problem with people calling me the morning of and saying, you know what, I'm just not ready. I don't think he's ready. And that's fine. And then we make another decision whether or not we wait a little bit longer or set up another time, when we think it is time.
And I think that's such an important relationship to have, as you mentioned, because you need a sounding board. You need someone with less of an emotional connection to your pet to be that voice of reason and to really help you decide when it is time. Because I think, if I had a conversation with my husband and my kids, we could keep coming up with reasons why, today's not the day. We don't know. Let's go one more day. Let's go one more day. Let's go one more week. Whereas you're taking an approach where you're really evaluating the situation, the health and well-being of the pet. So I think that's a real important relationship to have.
Yeah, I know. A lot of veterinarians too do hospice calls. So I've done that too, where I've just gone over their home and I've met with the whole family, and we talk about what's going on. And I talk about, okay, so he does this. Okay, he still does this. I watch the dog walk around. I watch the dog interact with the owners, and I help them decide when it's time for them, and be that sounding board, which I think is so important.
Yeah. Thank you so much for being that resource for people. I think that's so important. And the fact that you can go into people's homes and just, give them peace of mind and let everything unwind in a familiar situation to them and to the pet. I think that's ideal. So thank you that you offer.
Oh, thank you. When I was in private practice, we always did it at the practice. And one day we had a client call and they really wanted a house call and we could go out and do it. And I did it once in private practice, and it was the most peaceful experience I've ever had. And when I started doing Acupetvet, I thought I have to continue doing that, because it is a lot different. And some animals really don't mind going to the veterinary clinic, and sometimes that is okay for you and your dog, and that's fine. But if you do want another alternative, it definitely is it's definitely really peaceful.
Excellent. Well, and I know too, if people want to reach out to you, if they want to start that relationship, what's the best way for them to connect with you?
Sure, you can check out my website, acupetvet.net, and you can also call us at 603-833-2313 or email. And my email is on the website, but it's also info@acupetvet.net.
Excellent. And happy 4-year anniversary, by the way. I know
thank you.
Big time for you.
Oh, I'm so excited. Honestly, it's so much fun doing what I'm doing. I love my clients. I love my patients, and I'm really excited. It's been 4 years, and I can't wait for another 4 and more to come after that.
That's awesome. And I know too, if you're thinking about care for your senior pet, I know you've got a really fantastic offer that people could take advantage of here between now and the end of the month. If you want to talk a little bit about that.
Sure. I do have an acupuncture and laser bundle. And basically it's $400, which is $50 savings. And what that includes is basically a conversation with me. You tell me what's going on with your pet specifically, what concerns you might have. We talk about nutrition. We talk about supplements. And then we give a treatment to help out with any pain and inflammation that I might find during my exam. And then after that, we discuss what good prevention or treatment would be for him or her going forward.
And so that offer can extend to our feline friends as well?
Oh, absolutely. Yeah.
Awesome. Well, we appreciate that because, thinking of senior pets and any of the techniques and therapies that we can implement now to prolong their life, is where I think the majority of us are focused when we're, thinking of quality of life for our furry creatures. So let me just see if I have any last questions here for you. So here's one more from Louise. She asks, what are your thoughts on hyaluronic acid for a joint supplement? For example, MovoFlex.
MovoFlex. MovoFlex actually is a really good joint supplement. And the hyaluronic acid in it, it's not really that ingredient that that really gets my attention. Hyaluronic acid actually doesn't get absorbed into the areas it needs to get absorbed in to help. But MovoFlex definitely has a lot of research that backs up the anti-inflammatory properties. But there are a lot of hyaluronic acid supplements, and like I said, that ingredient itself is not one that I usually recommend because it doesn't get absorbed the way it needs to help out the joints.
Well, thank you for all your great advice as usual, and thank you everybody for your questions. Again, if you want to connect with Dr. Wilson, please check her out at her website at acupetvet.net. And also, if you have any additional questions, feel free to just post in the stream of this broadcast in the Dog Walking Club group, and Dr. Wilson will follow up with you and answer your questions as well. Absolutely. So again, thank you for your time. Happy anniversary. I know that we will be seeing you next week for our official club party, or I should say party, Pawty, where we will also be joined by Allison and Kelly from Mary's Dogs, who will be talking about their wonderful organization, and we will be giving away lots of prizes. And most importantly, I know that you will be helping to evaluate pictures and videos that pet owners share about their dogs, helping them to evaluate if their pet is having any kind of pain. Do you want to talk a little bit about what you're looking for?
Sure, yeah. So last week we talked about different postures that our animals can be doing to show us if they're uncomfortable or in pain. And I wanted you to take a look at your dog in the next week or so. Now I guess we're talking about a week now. And send me pictures. If you think maybe they're not standing the way they should or walking the way they should, send me like 15-second videos, 20-second videos, some pictures, and I'll help you determine if there might be something going on just by pictures themselves.
Great. And there is a thread in the Dog Walking Club that you can tag that onto, and then Dr. Wilson will address your pictures and your videos specifically, giving everyone tips and ideas and her thoughts when we have the party on the 24th. So looking forward to it. Thanks again, Dr. Wilson. Always great chatting with you, and I hope you have a great night.
Thank you, too. Thanks, guys, for joining us, and love the questions, so keep them coming.
Awesome. Take care, everyone.